hypertension, high blood pressure. The normal value of the blood pressure is 120/80. The top is the systolic blood pressure, while the bottom is the diastolic blood pressure. Systolic blood pressure is produced when there is contraction of the ventricles, while the diastolic blood pressure is produced when there is relaxation of the muscles of the ventricles. The blood pressure, high blood pressure is produced due to the increased blood volume, increased ejection click, and the increased vascular resistance produced by the deposition of plaque in the walls of the arteries. So these three factors, they produce the blood pressure. Usually it is a long procedure or pathology. The symptoms appear mostly after 55 years, near 60 years. That is why it is called as silent killer. So regular checkup of the blood pressure is compulsory and necessary for maintenance of the health during all the phase of the life. The diagnosis of the hypertension is starting from the general CBC count, then calculation of the ESR, C-reactive protein, and tropopin estimation in the blood. X-ray chest to visualize the pleural effusion or the other complication of the lungs which are produced by high blood pressure, that is the chest pain and the dyspnea or the shortness of the breath which is produced in the high blood pressure patients. So any complication in the alveoli or the bronchioles produced due to the high blood pressure in the vessels of the lungs. Next is the classical test, that is the resting ECG test. In this we mostly emphasize over the state of the formation of the T-ST segment, whether it is elevated or it is depressed from the normal limit. T wave, when it is normal according to the baseline, whether it is elevated or it is inverted. So these two factors, they produces diagnosis of the high blood pressure and the ischemia of the heart muscles due to narrowing of the coronary artery. Due to high blood pressure, that produces inflammation and the plaque formation. And that is responsible for the various heart complications. Echo test, it is the sound waves are used to visualize the interior of the heart over the monitor or even the TV screen, and also we get the scan. So we visualize the arterial, atrial septum condition of the atrial septum and the ventricle septum, whether there is any pore formation or hole formation or other deformity in the septum of the atrium and the ventricles. Condition of the valves, whether they are normally function or there is incompetence of the valves, there is regurgitation, and we also calculate the ejection click of the ventricles and flow of the blood through the valves through the via aorta into the other arterial system. So by echo test, by means of sound waves energy, we can visualize the interior, the walls and thickness of the walls of the various left or right segment or the side of the heart organ. Next, we can approach, that is, what is the prevention of the high blood pressure, hypertension. Prevention is mostly healthy diet, which should be devoid of saturated fat and the sodium salt. Because saturated fat excess produces plaque formation, and the excess of sodium that produces in the high blood volume, retention of fluid, there is edema formation over the ankles and the feet. So excess of sodium should be avoided. Regular aerobic exercise for 30 minutes daily. Management of stress, anxiety by the yoga exercises and to adopt the suitable and useful relaxing hobbies. So these are the various factors. You should avoid the obesity, that is, control your normal weight of the body, which is compulsory to avoid the occurrence of the high blood pressure. Quit smoking. Smoke consists of thousands of chemicals which produces very dangerous effects over the vessel walls of all the organs, especially over the heart and the kidneys and the lungs. Moreover, you should limit the intake of the alcohol. So these are the basic factors. Preventive measures are you can say, we have to avoid these factors to maintain the appearance of the hypertension. Now the treatment consists of diuretics. We select the diuretics spironolactone, which is a potassium-saving diuretic. Then is the beta blockers. These drugs, they control the heart rate and also lower the BP. But these medicine, beta blockers, should not be given to the patient suffering from any disease of the lungs, COPD or other disease of the lung. Next is the ACE inhibitors. Then there is the calcium channel blockers medicines. Then there is the vasodilator medicines. All these medicines, they work or they stimulate the function of the heart towards normal ones. That is, they control the heart rate, force of the heart, ejection click, and also the resistance of the valves which are stiffened. They relax they act over the smooth muscles of the arteries, and they produce a relaxation of the muscles of the arteries. So the resistance towards the onward flow of the blood is decreased, and the overloading over the ventricles is also lessened. So these are the various factors and the medicine which are used. Usually in hypertension patient, more than one medicines, they are selected by the healthcare providers for the patient according to the factors which are responsible for production of hypertension in the patient.